Good afternoon. Oh, geez. Good afternoon, everyone. We are about to get started. I know that Madam Chairwoman Katie Muth is on her way, but in the interest of time, and we would like to get started with this hearing on serving the homeless in the wake of the Grants Pass ruling, which is a joint policy hearing, Democratic policy hearing between the Senate and House. It's an honor to be here in Lancaster, to be in the district of State Representative Ismail Smith-Wade-El, who we'll hear from shortly. What I'm going to start with is just a few brief remarks. Essentially but our interest is, of course, in hearing from organizers, affected people, and experts on this issue. So I'm Nikil Saval. I have the honor of representing the people and communities of the 1st Senatorial District, which runs through the heart of Philadelphia. The subject for this hearing is sort of in the title of it, which is the fact that the U.S. Supreme Court recently ruled in Grants Pass versus Johnson permitting local governments to enforce ordinances that ban sleeping on public property without regard to the availability of other accommodations, even though sleep is a biological necessity. In the wake of that hearing, Rep. Smith-Wade-El, myself, several others, anticipating it to some degree, got together and produced a co-sponsorship memo intending to produce legislation to address the potential criminalization of homelessness, but also to ensure that we proactively, finally, serve the people who were housing insecure, at risk of becoming homeless, in order to kind of address a longstanding need in our Commonwealth, the ability to serve people who are unhoused. We do that to a very minimal degree, I think we can all agree, but not to the degree that we should. And so this afternoon, we're going to hear about what the options are right now for those of us who can't find an affordable apartment to rent, what life may look like for us, for our homeless constituents, if the Commonwealth or local governments in the Commonwealth criminalize camping, and alternative responses to the housing affordability crisis. Again, I want to thank my colleague, Senator Katie Muth, and her staff, as well as my staff, Rep. Smith-Wade-El's staff, and all the participants and audience here today for making this hearing possible. I especially want to thank the Senate communications team and the House communications team, and Lancaster and Lancaster City Hall for hosting us. Just another 2 points on this. Homelessness is you can look at the research that suggests variation among geographies, and there's no, I think there's certain rumors around, whether weather or certain kinds of topographies or geographies are conducive or not conducive to people being homeless or not, and none of that is true. Everything, what tends to determine homelessness is the availability of housing and the cost of housing. And so, there are some vulnerabilities that might include, influence which people are susceptible to homelessness, but really what drives the homelessness crisis is our overall housing crisis. That said, there are, folks who are more, who are, because of discrimination, because of other, factors in the history of our country, are more likely to become homeless than not. So people who are just as impacted, Black and brown folks, there's data that we have recently from the annual homelessness assessment report to Congress, which suggests that the number of transgender people who experienced homelessness increased by at least 26% between 2019 and 2023, while the combined number of gender non-singular and gender questioning people experiencing homelessness increased by at least 183%. Just for a comparison, the number of cisgender women experiencing homelessness increased 14%, and the number of cisgender men experiencing homelessness increased 15%. Overall, an increase, but a clearly disproportionate increase. And that of course, is true for a number of different vulnerable and impacted populations across our country and certainly in this Commonwealth. So for a number of different reasons, there's an credible exigent need to do something. And we want, as we consider legislation, we want to be informed as legislators, but also, about what can be done, not just, of course, in the legislation that we produce imminently, but in, as we consider, and the governor announced this recently, an overall housing action plan for the Commonwealth. So with that, I am going to turn it over to Rep. Smith-Wade-El.
Thank you, Senator Saval. Hello to our testifiers, to staff, and to the fantastic people of the city and county of Lancaster. It's been a minute since I've sat in one of these chairs, but it's nice to be back with you this afternoon. So as my colleague Senator Saval accurately summarized for us what the hearing is about today, I just want to provide you with some additional contextualizing information before we get off to the races. Oh, actually, I'm so sorry. We have the chair of the Senate Democratic Policy Committee, Chairwoman Katie Muth, everyone. No, please.
Thank you.
Senator Muth is going to address you briefly, and then I'll come back to what I was saying. Senator, you're good?
Yeah.
Okay, great. Thank you, Chairwoman. So a couple of pieces of information, but first and foremost, we're going to hear from testifiers over the next couple of hours, specifically for the purpose of the benefit of your legislators in the Pennsylvania House and Senate. This hearing will be recorded and broadcast, and it will be made available to every member of the Pennsylvania General Assembly. So what we hear from our testifiers today will become part of the permanent record. But as we know, this is a pressing issue here in our community, not in general, but in specific. And so I would encourage each of you strongly to make time for a community conversation on housing and homelessness being hosted by SOWE. The details are as follows. That's going to be on September 25th at Tech Centro West. That's 57 Laurel Street in Lancaster City, and that's going to be from 7 p.m. to 8:30. I will be there. Deb Jones, the Executive Director of the Lancaster County Homelessness Coalition, will be there. Mylan Kneff, who is an outreach worker from Tenfold and is also right over there if he wants to wave his hand, will be present, as well as David Enkel from the Homeless Advocacy Board. So that's going to be an important place to make this issue local for our community. Okay. Now into things that are actually relevant. Maybe as you know, before I was a state representative, I worked with the Lancaster County Homelessness Coalition. There's two documents from the federal government that I want to bring your attention to. In 2019, the Department of Housing and Urban Development published a memo on encampments of the unhoused, is how they described it. It was 2019. And the thrust of that memo was that encampments of our unhoused neighbors had reached a level not seen in, this is the exact language the Department of Housing and Urban Development uses, almost a century. And they leave what that means as an exercise for the reader. So 2019, almost a century. I will leave that for you to sort out the implication there. The other is a 2021 report from the Government Accountability Office, who was auditing the Department of Housing and Urban Development. A thing that they make explicit is that for across the country, for every $100 increase in a community's median gross rent, the likelihood that an individual in that community becomes unhoused increases by 9%, and underlines that the primary driver of houselessness is the cost and availability of housing. I know there's some public discussion on this, and there are many things the healthcare system, incarceration, substance use that operate around the periphery. But the clear primary causative factor of an increase in the number of our neighbors who do not have four walls and a roof within which to sleep is the cost of accessing four walls and a roof. So just want to lay that out as explicitly as possible. I also want to note that in this year's budget, the Pennsylvania General Assembly voted to increase the only dedicated source of funds that we have for providing support to our homeless, to our unhoused neighbors. That's the Homeless Assistance Program line item, and I encourage everybody to watch the Department of Human Services 1115 waiver project with attention that would allow Medicaid dollars to be spent on housing supports, rental assistance, permanent supportive housing, and Medicaid dollars. Now, this is a pilot, but Medicaid dollars form the single largest portion of the Commonwealth's budget, and if expanded, have the opportunity to massively increase the amount that we spend on housing. Another progress area, which I would largely credit to you, the citizens of the Commonwealth, is that for the first time this year, the Commonwealth is distributing funds to support not just indigent defense. So this is, if you're not familiar, this is in Law and Order when they say, you know, if you cannot afford a lawyer, one will be provided for you. I watched too much Law and Order as a kid. It's negatively affected who I am as a person. Anyway.
And who can afford a lawyer?
Yeah, truly. So Pennsylvania, 2 sessions ago, Pennsylvania was one of 2 states in the union that provided no money for indigent defense. Now we not only provide funds for indigent defense, but we support our local legal aid partners with monies specifically to ensure that more tenants have legal representation when they go into court, and simply having legal representation when you are faced with an eviction starkly decreases the likelihood that you will be evicted and the likelihood that you will become unhoused. It's not enough, but I want to make sure to give credit where credit is due. I am going to, now that I've been talking forever, pass it back to Chairwoman Katie Muth just for a little housekeeping before we get into our testimony. Thank you, everyone, for bearing with.
Good afternoon. I'm used to saying good morning. Good afternoon, everyone. I apologize for being late. I'm recovering from a little bit of food poisoning, so my commute here was tricky. So I want to say thank you to both of my colleagues, which are also 2 of my friends. Not everyone in Harrisburg is easily to call someone a friend. So I want to say thank you to them for kicking off the hearing so we started on time. Also to our comm staff, my executive director, all the staffs for both Rep. Izzy and Senator Saval's staff. They are all amazing and hustle hard to try to make magic happen, and they do that on the regular. So thank you. I want to mention that to my right, Representative Perry Warren has also joined us from Bucks County. Thank you. We should have carpooled. Maybe we could bet on the turnpike. I'm very glad to be here today. This is a beautiful area. I've only been here once before in the actual city part, but it made me feel better as soon as I got out of my car. So I was going to say thank you. There's a lot of warm faces on the sidewalk and beautiful surroundings. So thank you for hosting us here in your district, and also to City Hall and the mayor's office for allowing us to use this amazing space. My colleagues already said what we're here for, to talk about a really important issue, and I think it's important to acknowledge I represent Senate District 44, which is parts of Chester, Berks, and Montgomery counties. You represent a different county, you represent a different county, you represent a different county, and all 67 counties are struggling with this issue. It's just a matter of the number of people within that county's population that are struggling either to stay housed or are already unhoused. And I think it speaks volumes to the issue at hand that we obviously have an affordability problem relative to housing and secure and safe housing, right? And so honored to be here today with 2 champions that have led on this issue for quite some time in Harrisburg, since you both arrived in Harrisburg. Housekeeping. We have a lineup of amazing testifiers today. We have 2 panels. We will have all of the testifiers from panel number 1 give 5 to 7 minutes of verbal testimony. Then after all 3 are finished in the first panel, we'll do Q&A with the members. Then we move on to the panel 2, same thing. So I'll give you a little friendly wave when you're at about 5-ish minutes so you know, just in case you lost track of time. And then panel 2, and then we'll have Q&A and then closing remarks. And this is being live streamed and also will be recorded as mentioned. So for anyone who can't tune in real time and you want to share this hearing with them because it's going to be very informative, and all the written testimony is also available online at senatormuth.com/policy. So that's all available for you all to read over and share as you see fit. So thank you again for everyone being here today. And we are going to kick it off with panel number 1, which is going to be a discussion about lived experience. And we are honored to have Dr. William Fife, Lancaster General Health Physician, here with us today. Thank you, Doctor. Your floor is all yours.
Thank you, Senator Muth, and I hope you feel better and don't need my services. And thank you, Senator Saval and Representative Smith-Wade-El and Representative Warren. And thank you all for everybody else who's here who's interested in this issue. I'm here today as a family doctor in Lancaster City, where I've practiced for over 20 years. In that role, I have the unique privilege of listening to patient stories. On average, every week I hear between 50 and 100 patients tell me about their health, their joy, and their suffering. I'm here to amplify those voices that I have heard. I will try to faithfully and respectfully present some of their collective thoughts and individual stories on housing without betraying the trust they have put in me to maintain their privacy and dignity. In my role as a family physician, I am not focused on only one system or part of the body, people's body or mind. Patients are free to tell me about all aspects of their lives, and they often do. I listen to patients when they are sick, grieving, hospitalized, giving birth, and dying. I also work as a professor of family medicine at Lancaster General, Penn Medicine, and along with my colleagues, 3 years ago, we began a project to provide health care to those living on the street in Lancaster. My patients seem united in their joy, comfort, and warmth when they are safely housed. In contrast, I have seen how the lack of safe and affordable permanent housing has ravaged the lives of many patients. The Supreme Court in Grant's past case decided that local governments banning sleeping or camping on public property do not constitute cruel and unusual punishment. Unfortunately, I have seen my patients suffer the cruel health effects that come without safe and affordable permanent housing. Gangrene, limb amputations, psychotic breaks, substance use disorder, hypothermia are only some of the cruel and unusual punishments that homelessness has doled out to my patients. Housing crises are at the root of many major medical problems, and lack of housing steals approximately 30 years of life from an unhoused person, more than double the deadliest cancer, lung cancer. If it were technically a medical condition, homelessness would be more akin to HIV/AIDS without access to treatment. The game musical chairs serves as a useful metaphor for homelessness. Early in musical chairs, there are enough chairs for all players, but as the game goes on, chairs disappear and a smaller and smaller group has a chair to sit on, with the other players leaving the game until only one person remains. In the party game, players who leave the game get to enjoy watching the competition, or maybe eat a piece of birthday cake. But in the musical chairs, that is the housing crisis. With less and less housing, those left without a home undergo loss of autonomy, privacy, community, calm, warmth, and much more. So in this musical chairs game of housing, who is it that loses their home? Those who are already physically or mentally ill, the elderly, or those burdened by poverty or socioeconomic status. It is as if while the music plays, there are some people who round the circle trying to find a chair while limping on crutches, blind, dizzy, or short of breath. The people I see in my office every day are the ones disadvantaged by these disabilities, because they are also the ones that need medical care. While writing this testimony, I look back on the last week of patients that I saw in our medical office. 6 of the 40 were homeless or on the verge of homelessness. Why aren't there enough homes for my patients? Every day in my medical office or in the hospital, I hear similar refrains from patients. I think I'm going to lose my home because the landlord is raising the rent. I've started to live with my son because I could not afford my rent. I had to start living in my car because I could not continue to afford the rent. Please don't discharge me from the hospital because I have nowhere to live. Please don't discharge me because I am pregnant and lost my apartment. Housing for many of my patients is just too expensive and there's not enough of it. Additionally, there is a lack of public shelters. Here in Lancaster, with 597 people identified as experiencing homelessness in January of 2024, the only low-barrier shelter with a mere 40 beds closed this past June. Our largest high barrier shelter, moreover, is not able to take patients or people with significant medical or mental health needs. Because there is nowhere else to go, or because they cannot be accommodated by a shelter, some of the most vulnerable people in our community start living outdoors. With other people without housing, they sometimes form encampments in public spaces. These encampments can make other people in our community feel uncomfortable. As we sit here in City Hall, I sympathize with the challenges of local governments. The public complaints about encampments, and there are public health risks from encampments when they lack running water or bathroom facilities, where there is violence or dangerous drug use. But once encampments have formed, I strongly believe there needs to be a healthy way to address the people living in the encampment. I agree with the National Healthcare for the Homeless Council. Encampment sweeps are counterproductive, costly, and harmful. The only study to address safety in a community before and after a sweep showed no difference in crime in the area before and after the sweep. Another recent study showed encampment sweeps to be physically, psychologically, and socially destructive to the people living in the encampment. They also divert police and community resources by just moving people from one place to another. By sweeping an encampment, we are only sweeping the problem from one community to another and never addressing the core problem. As a family doctor, I strive to effectively address core problems and treat as many conditions in as many people as I can. If you cannot breathe well because of pneumonia, I often can treat you so you can breathe normally again. If you are suffering from HIV/AIDS, I can choose medications that will help you live a full and healthy life and not transmit your infection to anyone else. If you separate your shoulder, I can put it back in place. If you are pregnant, I can take care of you during your pregnancy and deliver your baby. But if you come to see me with a housing crisis, I can't really help you. Some people would say this is not your job, Dr. Fife, but as I have said, housing crises have a greater impact on my patients' lives than a cancer diagnosis. And the resources we use to treat problems engendered by lack of housing could be used to create more permanent, affordable, and safe housing. A few examples of patients in our practice. A was a 34-year-old unhoused gentleman with asthma who was admitted 7 times in the winter because living outdoors worsened his asthma. This cost about $110,000, enough money to fund a transitional housing bed at $50 a day for 6 persons for an entire year. B is a woman who was 5 months pregnant and living in an encampment just outside of Lancaster City. She was staying at the Water Street Rescue Mission until asked to leave because she did not meet their requirements. She has sought other shelter options, but none are available. She has no money for the bus, so she has struggled to access prenatal care along with food. She is in early recovery, which is highly in jeopardy because people around her are using methamphetamine and fentanyl. She is tempted by methamphetamine to allow her to protect herself from staying awake and vigilant at night. Sleeping in a tent while 5 months pregnant is only adding to her stress. The cost of the loss of healthy desired pregnancy is incalculable. C was a 46-year-old with diabetes who was often without housing after fleeing from an abusive roommate. She worked as a Grubhub driver, but lost her job after losing her home. Infections from living on the street or in her van, vomiting due to a complication of her diabetes, and from not being able to prepare her food, amputations due to infections, a stroke, and a heart attack all ended her in a hospital about 10 times per year for about 10 years before she sadly died of complications of an infection. Lack of housing was at the heart of her illness. When she was housed, she could control her blood sugar, keep herself clean to prevent infections, and eat well. This lack of housing cost our health system well over $2 million and cost her her life. If she was able to put that money into housing, she could be living in one of the most opulent homes here in Lancaster. Or even better, build 250 tiny homes on wheels to house the over 500 people experiencing homelessness in our county. I could go through many alphabets of patients whose housing crises damaged their lives, deprived them of health and safety, and distracted me from taking care of their medical illnesses. The simple solution is ensuring affordable and safe housing. There is money available for this. If we stop housing people in the most expensive places, like hospitals or mental health units, or now following the grant's decision, possibly jails, the cost of healthcare and the cost of their cost on their bodies, minds, and souls could dramatically decline. The grant's past decisions should compel us to focus on the root causes of homelessness so we can prevent people from experiencing the damage from homelessness in the first place and help those currently living without a home to find safe, affordable, permanent housing. When my next patient comes in a housing crisis, I want to be able to refer them to a fully funded homeless assistance program that could help them stay in their home. Or better yet, I hope that through the efforts of people here in this room today or listening today, none of my patients experience housing crises again. Thank you for listening.
Dr. Fife, I appreciate the making it human, giving stories. You've seen those things up close, so I
Thank you for letting me amplify their stories.
absolutely grateful for your participation today. Next, we have two individuals from Philadelphia Action Housing. We all should have carpooled, I guess, right? Or did you carpool, Senator Kaval? We have Sterling K. Johnson, who's an organizer, and also Wiley Cunningham. I'm going to announce you together. You can go whatever order you'd like to go, or chime in with each other, however you'd like to do that. But the floor is all yours. Thank you.
All right, thank you. My name is Sterling Johnson. I am an organizer with Philadelphia Housing Action, a person that has worked in mental health advocacy, discrimination law, currently a triple PhD. So I've been through the nonprofit space to then end up where I am now, which is organizing with individuals that have lived experience of this. That includes Wiley Cunningham, and the audience are with us, Scott Gilson, and as well as Janie Mitchell, who has been focusing on the intersections of housing and how Department of Human Services and Child Protective Services rips children from the arms of mostly Black and Latinx mothers, which leads to so many other terrible things for people's lives and also the communities. So for myself, person with lived experience, been through treatment, current harm reductionist, and live in South Philly right now. Grew up in Montgomery County in your district, Senator Muth. And the main action that was taken by our organization was to take houses, vacant viable properties from the Housing Authority, and then make them livable, support people while they're in them, and then basically demand that they be transferred over into a land trust. And we were able to do that in 2020. That was a part of a historic action. But honestly, it is historic at the time, but this is something that has been done many times in Philadelphia, to understand that there's vacant properties that are usable in the city, and for people to take their families in them and to use them, to work with the community around them and to keep them safe. And we have been people that have been keeping families safe, in a real peer support model for the last 4 years. That's what we've been successfully doing, and in coordination with the Housing Authority. Right now, we have transferred 16 houses, 14 families living in those houses. And we do that, with ourselves, but also with the help of everybody in the houses working together as the model that is going to be successful in terms of the things that we believe in. It's self-determination, self-advocacy, sharing resources to make this thing work for us, right? We can't really, from our standpoint, you can't Medicaid your way out of this. You can't pay for every single way that we are going to support ourselves. So, and what we're seeing right now is it's quite troubling with the Grants Pass ruling. Previously there was the ruling of Martin v. Boise that needed to have adequate housing to criminalize. I guess criminalize means so many things, from banning camping to banning sleeping to banning cardboard to banning blankets. All sorts of creative ways to brutalize people. We say people experiencing homelessness, but I will say the way that it works is if you look homeless, it's going to be enforced against you. So that look could be anything, and especially when it comes to people that are Black, people that are disabled, you'll probably have it enforced against you. And so, I think that gives us an opportunity to really focus on this, and not just on the criminalization part. I don't know. For me, the criminalization part just makes sense, right? So if you're criminalized, but it's like, I don't know, try to get into treatment, try to get into a housing organization, try to get into anything, you won't be getting in. They will be I don't know, maybe we can even just take a second to recognize like what actually happens. It's like what actually happened is you will be put into a jail cell and they will, be looking at your detainers at different counties. And at least what happened to Amanda Cahill was that she suffered through probably a fentanyl and xylazine-induced withdrawal that led to her death. And these are not things that might happen. These are high potentials, possibilities, probabilities that will happen. So now instead of having the treatment that that person should have gotten within the treatment system that exists, honestly, even the hospitals are in this, right? That person died and her sons don't have a mother anymore, and her friends and her sisters and her mother, it's like those people don't have a person that's a part of their family. And I guess when we talk about this, I guess we want to stay at that point. It's like, what are we doing to help people in our communities? They could be homeless, they could have houses, they could be, it's like, but these are people that are us. And I like to stay away from kind of like understandings of like this other category of human. It is not. People are human. There are facts that go along with what they need. And I try to just stay in the place of what have people experiencing homelessness currently said that they actually need. And that actually does change at one time. So the last survey that I've seen was done in connection with the Homeless Advocacy Project. It did seem as if there needed to be some housing subsidies that were pretty flexible amongst, probably across county, that were done by the state, and also permanent supportive housing was an important part of this, but at times the actual issue that we were coming across was that people did not want the permanent supportive housing that was being offered to them. And at times, permanent supportive housing can be very open and very supportive through social supports, but at other times, there's permanent supportive housing that, if you're in recovery, it doesn't allow you, it not only doesn't allow you to drink, I will say in my experience, with fighting for people in mental health spaces, there's a sense of surveillance and punishment if you even bring a beer into a place. So I just want us to kind of think about those particular situations when we're thinking about what is the way. It's like autonomy, self-organization, and not this like focus on punishment has to be where we're at. And as time goes by, I feel like I can just go through a few of the main parts of this of the testimony. I would say that design and understanding the user experience of people experiencing homelessness has to be part of this, and it means like respecting people's privacy and rights. If you're at a shelter, they should not be announcing your HIV status at any other place. If you're, even when it comes to the current state of methadone and Suboxone, it's like there's a certain sense of privacy that people that are often in margins or that occur in trans they are not being given in terms of like the dignity of them. And I really want to focus on like what can be in between either hospitals or housing and recovery housing. There are so many parts and supports that need to be done. In 2019, we are kind of brought together by Janie Blackwell's office, which is very interesting, which led to the establishment. Janie Blackwell is a city council person in Philadelphia, and it led to the establishment of respites that were the places where people could be released from hospitals when they had complex medical needs. So my experience is that they're not always perfect, but those are the sorts of places that need to be funded through Medicaid dollars to keep people in. You can get 30 days after you come out of the hospital in this respite. And so instead of us seeing somebody in a wheelchair or like a wound, like maybe an intense wound, and also medication and regimens that have to be managed like on the street, which is merely impossible, you should be doing that in a medical setting. And that's why I've been at this place of like, there should be no wrong door. I should see nobody on the street with a medical bracelet saying that, and this is the space where we can do this. So as a person where I know my mother had a stroke, I meet people that they have a stroke and then they come out of a hospital They go back to their house where they're evicted. So now they have all their stuff, right? But that because they had a medical catastrophe happen to them. So what does that do to not only them, but to their communities? And I just encourage us to look at the hospitals that need to be giving much more money than what has been given. I know there are some cute boutique programs, but there is a need for changing the whole system, making sure that they are giving enough, and also we need actual people like I've mentioned it. As was mentioned to me, HDC, Mid-Atlantic, Lancaster, or POA, or some preservation of affordable housing. We've just been, we had this situation where we're doing tenant organizing, and we're wondering who will be the managers of these large properties. We know that that is not an easy thing for a group of people who have never been in the real estate space, but you need people that are going to pay attention to residents, treat their concerns as real, not try to just brush them under the rug, but then actually answer them. And I think that for me, understanding some of those dynamics is pretty key to keeping people in their homes. And when our experience also was there seemed to be this rotating thing where people would sell off properties but still get access to tax credits, which has happened several times, whether it's Mission First, Brett Altman, the Ingram and Management Company, and it's like that's just our experience as me. It's like talking to individuals about what they felt at the time, and I understand, yes, there are we live in a capitalist space where there are lots of pressures, but the way that we've really focused on our space is that if you're have an intense disabling condition, that the answer from our organization or any organization shouldn't be to evict you. There have to be spaces that allow for that person to stay in their home. And I want us to think about those things, because sometimes we don't even meet those things, those issues from the state or federal level of understanding when that happens. What is the money that was supposed to be paying your rent? What happens now is those people are on the street. I think that should really be taken into account. And I will say it doesn't, I say that there should be a fair share commitment for all the 67 counties, right? We've seen recent backlash in Norristown and Pottstown and Havertown, even the Fairmount neighborhood, where they're trying to place and site these spaces that are supposed to be therapeutic, and they at least, I don't know, I'm a lawyer, I went to law school, at least that I understand nuisance law and things of that sort. It's like, no, these are therapeutic spaces. They are a benefit. They are an amenity to your community. So understanding them as that, and like I would say the business of that needs to be done. And I think that we've seen a lot of work needs to be done. Recently there's a lot of pushback, even in the Northeast Philadelphia, around a health center that was supposed to be sited there. But a lot of times that comes because of this dehumanization of people that are in recovery and people that are experiencing homelessness, and we have to turn that around. I will say, it's like there's several times I have gone into a little bit of this emotional space, but sensationalized stories. I do think that it is important to understand what is actually happening and what the experience is of these situations. And the sheer fact is that if you do not have enough money, you cannot pay the rent, you will be evicted, and you are told to go on the street. So when I see people on the street, they are just people that could not afford the current rent of them. And I will say, we also have to change the way that people escape homelessness, because when you don't have any rent to pay, there is a certain amount of exploitation that is happening towards people, whether, I'm in certain sorts of recovery too, where it's like it's like either your urine or your blood or being forced to go to a program at our mental health place that you don't even care about, but that there is a certain exaction of your time and your energy and your emotions that have to be taken into this too. So even looking at what is the industry of exploiting people in this situation, in the situation of being precariously housed, people in recovery, and in these situations, it's like that can also be a point of advocacy about how do we make sure that. I'm going to tell you, it feels when you make it through, you're like, you look back and all the people that died, all the people that you went to jail that died all the people that went to the recovery house that died in the recovery house, all the people that like you were in the treatment center, but then they just disappeared because they used and then they had to just kick them out and then they died on the street. It's like all that stuff. It's like, I'm trying to say this with as little emotion as possible because we have to change the entire like political economic structure of how we support people. And that means making sure that person comes to you with a thing and that you say that they relapse. I say, I know, relapse does happen. And yeah, we're gonna try and do whatever we can to make sure that this isn't like a horrible thing for your recovery and doesn't actually like take away your children, take away your housing, take away your job. We are here. And I try to understand that as like making sure that other people that are like us, that are in our situation, actually are getting the technical assistance to learn how to be, I don't know, to know how to be, now I'm a real estate bro. Now we're real estate bros and we're just like trying to get this money so we can support the thing, because when we talk about housing, you're talking about millions of dollars to rehab housing. You're talking about insurance, you're talking about, it isn't just the house, it's all the utilities that are related to that, and you have to learn it. And we looked at, I would say like all of us kind of looked at each other and we were like, there's no other choice. We have to do this, and we have to tell others how to do this because we're going to be the people that save ourselves. Nobody else will. Nobody. Black people, and I am not a mother, but when I look at the mother, they know that they are the people that will save themselves. And I did not do it. They saved themselves, and I thank them every single day for standing with us because we had to do it with a lot of people. And hopefully we're able to talk to people and maybe inspire people to do it themselves too. So that's all I have. Thank you.
Thank you very much, Sterling. Wiley, do you want to go ahead?
Have time?
Yes, we have some time. I don't want to cut you off.
I'll keep it really quick. 'Cause, I mean, Sterling already said. Sterling already said plenty about what we're doing, but I guess I would just offer a couple more elaborations. I guess my main comment would just be like, market solutions to the housing crisis is not gonna work, won't cut it, especially not to deal with homelessness and the income levels that we're talking about. Like, we work with a lot of people who are disabled, and if they have any income at all, it's SSI, and they're living off $750 a month. Like, these folks are not gonna afford market rate rents. They're not gonna be homeowners. They need subsidized housing. And like, that's the task here. Is we need to create and expand subsidized housing, and we need to protect the subsidized housing that already exists. And I feel like both at the local and state and federal level, like a lot more attention needs to be paid to that. Like Philadelphia, where we organize, actually does have a lot of subsidized housing, but over the next 10 years, there's 15,000 plus units set to expire, and there's no guarantee that they will be replaced. The way that privatized Section 8 subsidized housing works is once the neighborhood land values increase, there's every incentive to sell and let the federal rent subsidy expire. And I feel like every single one of those contracts needs to be viewed as a precious resource in any kind of housing action plan at the state level or on the local level. Like, they should be identified and singled out, and a lot of work needs to be done ahead of time to figure out how do we keep that contract in our district, because and everything you're going to do to try to create new housing for those income levels, it's not going to be enough if you're losing that at the same time. So that a lot of attention needs to be put to that. We worked with a group of tenants at the UC Townhomes in Philadelphia to try to defend and protect subsidized housing complex of 70 units. We ultimately lost that campaign and they were evicted, and that contract's gone. And there's thousands more like it that are set to expire soon. And I feel like a lot of attention needs to be put there, how to like protect and save those contracts, how to support tenants to purchase those properties if they're being sold and give them the technical support and match them with, as Sterling was saying, like some kind of housing provider that understands how to administer a contract like that and a property like that in partnership. And I think exploring that as an option might lead somewhere. And yeah, I guess, Sterling was already talking about it. People just generally need a lot of resources. Like, we had an experience of taking over vacant homes and people who were street homeless living in them. And yeah, the house is a huge piece of it, but people need a lot more than that, and even without any support, like, it did a lot for people. But, like, if you can't keep the lights on and you can't pay the water bill and you can't pay the gas, you're still struggling, and you're still at risk of losing your kids, or, and all that stuff puts more of a burden on the system. I guess I'd also say at the state level, a lot of the funding that's available, we're finding, it's very technically complicated to apply for and access, and many times you need to pay tens or hundreds of thousands of dollars to consultants for help with the application or capital needs assessments and this kind of stuff. So being able to access funding in any kind of significant level to make an impact is very challenging, and it means it's very restricted to a small group of providers. And anything that can be done at the state level to remove some of those barriers or encourage smaller scale outfits to get in the game and participate in meeting these goals and these targets, I think could also be really helpful. I'll just leave it there. Thank you.
Absolutely. I just want to mention that Representative Danielle Frill-Otten joined us. She's sitting to my left. And then also Representative Webster is participating on Zoom, so just as an FYI. And Representative Webster, if you're listening, just text me if you have a question, so I can acknowledge you. I will open it up to Q&A. I'll go to my left because I'm left-handed. Don't be mad, okay?
Thank you, Chairwoman Muth. Thanks to everyone for their testimony. I'll start with the sort of general question because, again, under the kind of the umbrella of the grants pass decision and what that sort of allows. I mean, a lot of what we are describing here is what is in a sense the current situation, right? We already have, as we've described in camp and sweeps, we have the jailing of the unhoused who all, due to, we have in the place of treatment, we have folks who are discharged from hospitals who have nowhere to go. I mean, we have all of that exists. What in your experience, I mean, and it's of course hard to anticipate because anything, we're under this new sort of post-grants pass regime. How would you anticipate kind of stricter enforcement or the adoption of, strict anti-camping laws? How would that affect the well-being of the folks that you organize with and serve? How might it, I suppose?
So I think the difficulty is going to be that if people are incarcerated or they're picked up by the police or they now have a criminal record, and if they have a criminal record, that's going to make it even more difficult for them to access services, to get a job. And so basically what we're doing with it is we are making poverty illegal in a lot of ways. And so that to me seems like the one of the biggest issues. And so trying to keep people from becoming unhoused in the first place, and those who are unhoused, making sure that they don't have to have significant contact with the legal system is probably a really important thing for them, so they do not have actual criminal records in addition to all the other burdens that they carry.
So I start to think about, like, kind of the way that like prevention and support kind of work in other spaces, whether it's, I just think about, I guess mainly the HIV criminalization space, where it becomes really important to understand what is actually happening for the people in the situation, as well as the people that are potentially can become, and you really do have to do both. I guess when I was talking about like what is happening for people that are on the ground, the increased enforcement, it's not just on them, but it's also on the people that are supporting them, and I feel like that's also troubling too. So there are people, at least in my experience, just like that go out into Forest of Berks County and Montgomery County and like give out syringes and even Lancaster, you know, all these places, like they start with harm reduction and like give food and socks and warmth and all these things. And what's been happening is that sometimes we see people, like they'll get picked up and they go into jail or something, and that's going to happen, right? So there's deaths that have already been happening. Like, but like what will happen is that people are going to go deeper and deeper into places where you can't even find them. And when we're talking about like what is like trauma-informed like care or something, it's like you can't come to people with a bulldozer and a garbage truck and take away their stuff as their first interaction with the government. And then expect for you to do anything. I'm just honestly meet myself to then step in and say, oh, I'm here to help you, though I seem to be a part of it. It's like, it doesn't work. It doesn't work. That's how you ensure like that thing gets fossilized. So the more enforcement we're going to see, like the more the like section and also the people, and I will tell you, it's like people, you want to, you know, sometimes they're just like, well, I don't know, I'll just, you know, I like to just it's like, I don't know, I'm not 4 years old, I'm not just white, and I just didn't just go to grad school and come out here. I know, like, when you're trying to support people, like, there's a certain amount of like, yeah, I'm here to support you, but like, yeah, also here's my boundary. I'm like, you can't do, you know, it's like, we're here for real talk with people and about like, actually, what are we going to do together to like help you get somewhere in your life. And none of that includes like taking the things that they need to survive, though. So I'm almost like, could you please at least not do the thing that makes it so hard for the people that are trying to do and trying to be in this space actually do good work? And it's like, what do we know? We know the people that were on the street at one time, and now they're, you know, living their lives and just doing it. And, you know, some people, you don't even, and the thing about so interesting is so good for some people you won't even know. It happened 20 years and they left it behind. It's not a place that they will ever want to go back. And I never assume, you never assume that somebody doesn't know that especially in the Black community, you know, especially, it's like people know. People lived through the 80s and 90s. They know what it was like. They know what state abandonment is like. When you said that your whole family like overdosed or this was happening, your whole family was killed, it's like, yeah, they know exactly what that is like. And it's like, especially when we're talking about, you know, cycles of like harm and state abandonment, I'm just like looking for us to figure out how we get out of it, how we forge new paths.
Can I
So,
have a
yeah, that's it. Sorry.
I just have a follow-up to Senator Saval. Like, this is a newer ruling, relatively speaking, and anybody can answer this, and Sterling, you know the area beyond Philly, so maybe you have, is there an area that, or one, is anybody tracking who is, you know, arresting the unhoused? I mean, anywhere in the country, but it'd be nice if it was Pennsylvania, if we had that data, but, or are there ordinances being passed that say we're going to take care of people and not, so that, you know what I'm saying? Like, it's like, okay, this town, I know I'm safe there, right? And I know that creates other, you know, things that other people might worry about, but I mean, or are there ordinances being passed or a policy with the police department, you know what I mean, at these municipal levels. And Philly's a little different as a city, but I mean, like, at local government, do we know of any entity that's, I know our police, like locally, our offices in Royersford and Montgomery County, and so if there's someone who's like, you know, we're working together to try to figure out, which is not easy, and despite I represent two very wealthy counties, it's very difficult to find resources. So do we know if that's happening anywhere in the Commonwealth?
I mean, in Lancaster, I don't think there's a specific ordinance, but certainly that there's been, Binns Park was the area that most of the our unhoused people in the city were living, and they're no longer there. And that was also the area that we provided resources. And just to back up on Sterling, like, it takes a long time to build trust. And so, like, as soon as that trust gets eroded by legal enforcement, like, you've lost that ability to potentially help somebody. But also, now Binns Park is dispersed in multiple places. And so the people that were there are now in many places, and they can't receive the services that they may have received in the past. And so I know my partner, Dr. Jared Nisley, he is sort of the focus person for our street medicine, and he has had to go lots of different places where in the past he was able to focus on one place and build trust there, and now he's like looking for people. He knows that they're there, but he can't really find them as well. And I think that, I don't know if that's a direct part of Grants Pass, but it seems like it happened soon after. But I don't think there's not an ordinance to protect people.
Sure.
And I think that's where the Commonwealth could really come in and say, hey, like, fill this gap so that we have a legislation that allows for people or prevents sweeps and things of that sort.
And I feel it's very hard to say this, but it feels very extra legal. Like, there needs to be extra legal means through investments and partnerships with current partnerships to do it. I have seen across the country where there have been protections for different, whether in Minneapolis, where it says, okay, you can have an encampment here, or Austin, where they're passed the ordinances, where I'm not sure how it was done, but they're like, leave these encampments alone, and that's the official policy. That has only been met with backlash against the people. So just kind of worry about just passing a law that is protective, and then it creates a backlash in that one city or in that one county. When I think about what needs to be done there, I mean, I think we've already know I don't know. I will just speak from my experience of being a low-income person, a middle-income person, and understanding like where the Black people are in like Pennsylvania. So if you're looking, you're like, oh, Coatesville, or like, oh, people Norristown. It's like you know where public housing has been allowed to be built, and like there has to that is some of the work that has to be done to allow for low-income housing to be built across corridors, and it has to be done in a responsible manner in a way that like understands the community. You may have like some backlash, but it just has to be done, and it's like, what is the fair share responsibility of every single county in Pennsylvania? And when it comes to stuff like, there's, I guess to end, the kind of bordering and things like these people aren't from here. Why are we building these things for people that are not? It's like, if we understand this as a Pennsylvania problem, maybe we can go from there, because there is that sense, no matter what, the person is from Mayfair, but how dare they come to Kensington, like 20 blocks away, to be, experience, it's just. But also, it's like also. For only one neighborhood to have to apparently bear the brunt of this, which does create this segregation and space for, honestly, the 9-county region that includes Wilmington and South Jersey, where my family lives too. It's so there has to be an understanding of the dynamics of this whole of it all, because I will tell you, it's like it would not be as big a problem if people were integrated into the community. When I think of law, I think about the Supreme Court I look to is Olmstead, of like people with disabilities deserve community inclusion, and that's the rule. And community inclusion means, like, I don't know, maybe there's like a 6-person house of people that are, rather than a 20-person house. So we're just like putting people back to back, like in this like 3-story room. That's exploitative. It's like community inclusion. Stay there, and and not everything's going to be perfect, but it's not going to blow up. Be a thing. It's not going to be a thing that then honestly, what happens, what has, things like, oh, okay, this is the reason. This is the prime example. These are the prime examples of why we cannot give to housing, we cannot give to treatment, we cannot give to, it's like, they will use they just use images of, I don't know, honestly, people like me, people with deformities, people with amputations, to be the examples. And that's the most hurtful part of, like, we don't deserve care. We deserve, and they'll show us on TV. And I know that those people deserve as much care as anyone, because like we know them. And also, I don't know, it's like we know them. It's like that person deserves care.
100%. Go. He's like jumping out of his chair.
No, you're good. First off, thank you, Sterling. No, I will use my allotted time just to acknowledge that what Sterling describes on a neighborhood-to-neighborhood basis in Philadelphia or wherever is very much the case here in Lancaster County, and I know that by virtue of the fact that I used to work for the County Homelessness Coalition, and I would read the shelter rolls, and we would go up to Ephrata, and we would have elected officials in Ephrata saying to us essentially that all of these unhoused people are coming from the city, and treating folks essentially as an invasion. And I just happen to know that indeed very much the reverse is happening. It's not always. It's frankly not great to be unhoused anywhere, and not necessarily in the city of Lancaster, but indeed it's more permissive than a lot of the other municipalities. And so folks come from those municipalities who reject funding for emergency shelters, via zoning, make it illegal to develop multifamily housing, et cetera, and folks instead then come to the city, and then they are used as part of a narrative, right, to say that, good God, Lancaster City, of 60,000 people in the middle of Amish country of all places, is, some kind of nightmare territory, right? And indeed, what Sterling refers to, we have land and we have resources in this county, and indeed in the entire Commonwealth, one of the most important states in the Union. So just want to reinforce that point that my interpretation is that if we understand these things as countywide and statewide issues, we're going to get a lot further than trying to solve, homelessness park by park. I'll yield my time. 100%
agree. My thought was the slow snail pace of the legislature and the interim of a state law, to protect what can we do locally to set that model, especially right after this ruling, to show that it is a good thing. Investing in humans is always a good thing. And this is one of those initiatives. Go ahead, Rep. Bottom.
Thank you, Senator. Thank you for your testimony. I actually grew up in Olney, have family in Mayfair and family in Kensington. I'm very well aware of all of the happenings in the city of Philadelphia and how that is a microcosm of what is happening in urban areas across Pennsylvania and beginning to happen in suburban areas like the areas that Senator Muth and I represent. I live in a municipality that during COVID became the place where all of the folks who were impacted by Hurricane Ida, the folks that could not be in communal shelters, and domestic violence veterans all got put into the hotels in one intersection of my municipality, and it created an incredible strain. But then also like you have said, when you show up with the bulldozer and the trash truck, there's nowhere to take those folks as a next step, because we've shut down the shelters, we've shut down the domestic violence shelters, and we don't have a plan for where these folks are going to go from the hotels, right? And that's created encampments, that's created all kinds of then community issues that then create more fear around homelessness and folks who are experiencing economic times of trouble. And so I'm just curious, is there anywhere in our country or in another country where they're doing it well, where there's a program or a system that's probably not perfect, because there are no perfect systems, but are there any places that we can look to that are supporting people well or better, that we can kind of model from or look at for some steps?
I would say we have a model for how to do that, and it's based on peer support and making sure that there's space for people. I would say that other organizations, over the history who have been able to do that, Dignity Housing, that's what they've done. They've made sure that you connected. Yeah, you just need more money to do it in terms of like supporting people. I think it's places in San Francisco that I've met around, like people that are experiencing homelessness, running their own hotel, making sure that they were responding to people they knew. It's like those are some of the ways that we've seen like people stay housed. And when I think about like what is the goal is to get people to remain housed. I almost think that I don't know, I'm not really in the political space, but something that like both sides usually can understand is that there's community based and like knowing people and community connections usually leads to like good results. If like sometimes the scale is what allows for there to be a sense of something being apart, and then there not being that much accountability around that. So I always think about when you're constructing a system, it should be able to be responsive to a person. If there are too many things between a person knowing that that person has children and also is disabled, and and they're in the hospital and they're evicting them anyway, then that's a problem. So that's, and there's ways that things can be structured that way. I think it's in much smaller, mainly community-based like spaces where that is happening, but sometimes it does become the issue of corporatization and scale that is not. I will tell you that it's like it's very interesting to talk to even people at the University City Townhouse. They remember a time when it wasn't like this. They were like, yeah, we remember when we knew exactly who the owner was and we liked him, but then things changed and there's like a luxury brand and the development is like, and then, so now when they try to talk to the person, refuses to talk to them and says, I don't care about your life. It doesn't, and I don't care that you knew my father, get out. Yeah. I will hire these attorneys to talk to you. And that's very different than their experience in 1985, and I think that's why it's like, basically, I don't care about like making points or something. We care about like actually like helping people, it's like, and I think that hopefully I was thinking about the homeowners repair work, like around that is like, let's get to a point that makes sense for people, and then also for like people that own homes, people that are renters, people that are whatever, and keep them in their homes. Let's make sure that there's money in housing subsidies to get people that have $0, have to have them pay $0 for 2 years, and then think about like programs like that are actually happening. And I think, and it has to be for more than a year. I feel like there's so many, Representative, like you bring up the thing around like, well, what good is happening? It's like, well, the issue isn't like what good is happening. The issue is that like, you can't there isn't a lot of those things happening. Like, so the hospitals are giving some money, and there's a Health for Housing great little pilot or something at PHFA, but like, I don't know, why aren't they spending $20 million a year instead of $1 million? Or like we exist and we know other good small organizations that exist that are doing like housing things around, but like, why aren't there, 10 other community land trusts in the city of Philadelphia that is like, that, I don't know, there's money for like technical assistance for people to like learn how to do that and understand that at a space where, it's always like we need to be in a space of abundance, and that there's enough time and energy for us to all learn this and like do this together. But, and I think that when I say that, I only say that because I don't know, we pay attention to what is going on, and to say that there aren't people working like all the time on this, or say that good things aren't happening. I mean, we just saw like eviction, where like we try to seal evictions in Philly, and we saw eviction sealing that could be done at the state, because that is affecting a lot of people trying to get into housing, and we know that that's being worked on. So it's like, I don't know, I'll stop right there, but I'm saying.
Like, I think, to your point, it's that there are these programs that do work and have success. I'm thinking Project Home. Like, I mean, so they just need, the dollars and where they go, which is all of our taxpayer dollars. The government's not its own bank. It's not a private corporation. Unfortunately, people treat it like that. But our tax dollars, the ones allocated to these projects, has nowhere near meet the need, right? And so like any person doing a budget, right, like you would in your own household, you're not gonna overspend on clothes, and then not have food, right? So like, how are we allocating the dollars to the need? And we know these programs work, they need to be scaled up, and there needs to be like an identify, in this area, we need this many units. And it's a lot, this has to be like a hard hustle. It's like, we're building like the Amish, like we're building fast, good quality, but we're building fast. Hey, they can put up my neighbor's deck and lickety split, but I'm just saying, because all the while this isn't happening, you just described what is happening. These people have nowhere to go, and they are human. Go ahead, Dr. Pike.
Yeah, I mean, it certainly strikes me that there's two very distinct groups. There's the people who are on the cusp of losing their homes, and just like we talked about, like maintaining the subsidies and subsidized housing is incredibly important for them. And then I do think the people that I see in the office who are like on the cusp of housing, in order to like maintain where they're living, is incredibly important. And so when I identify that, I don't feel like I can write them a prescription for a rent, but like if there was a place that I could go and say, hey, you know what, they're going to help you. And I do have some social work staff that does some of that, but it is really, really convoluted and very challenging to do, I think, for them. And there are certainly there's organizations that have for pregnant women or for specific groups that actually work fairly well, like in our county, in our city. So there's that group. But then there's a group that's also already living on the street, and that they have much different needs in some ways. They're still absolutely as human, and they've come to that like in a way that may have been very much like anybody else living in the world, but they also are already in a situation that's much more difficult. And so how do you like build that? Somebody from the audience just put down, have you for Hotel San Antonio model? I don't know that, but I just got handed that. So I don't know if there's I know that Houston actually has a model that's working to some degree. I just don't know. I'm not a housing expert. Like I'm just a family doctor. I wish I could tell you more about what works, but I think looking at those models are incredibly important, where there are accessible, safe, permanent models for people, and then how to maintain harm reduction for the people that are on the street, because that's the really That's a very challenging thing to do when people have lost so much trust in the people that are around them. And what we're doing with Grants Pass is actually, we're unfortunately like even worsening that potential distrust.
I'll just add quickly, like there actually are countries in the world where housing is a human right and it's enshrined in the Constitution, and there are no homeless people. I'll also say it's like within living memory of elders in all of our communities where this issue was not an issue in part of their lifetime because there was adequate funding for low-income housing at a national level that took care of this issue. And the representative here was talking about 100 years ago and the statistics, you know, and there was something done to deal with that. So I don't think like we need to reinvent the wheel so much as like, yeah, it's about priorities in the budget and how do we make this happen and how do we get creative about how to like leverage what resources we do have, because you all are sitting in the state, you know, you don't have the same bankroll as the federal government. It's a little harder to come by the dollars, but how do we get creative about what we do have if there's the political will and the consensus that this is the priority?
I'll end with this comment is that, and we move to panel 2, is that if we don't do this and people are incarcerated for being unhoused, we're still paying for that too. So the fact that we're paying for that, right, why wouldn't we just invest so that people can live a livelihood where they're thriving and they have resources, and then they become participants in the economy, which is a form of freedom, right, to be able to participate in the economy, and then all the money invested, this isn't that hard, right, comes back through, you know, sales tax and things, because more people can participate in the economy. It's like you said, it's really not that hard. We don't have to reinvent a wheel. It's just the courage to do something different.
Can I just say, I agree with what you're saying. Colleague Skalkosim wanted me to say low barrier shelters. That is what needs to be done. Those are not available in every community, and that is a really important issue for anybody.
Very importantly, and in our southeast area, I can attest to the fact I've been in the crosshairs of the Montgomery County battle to build a new homeless shelter that I gave an RCAP grant to, $2 million something, and still says not built because nobody wants it in their backyard syndrome, and even a Catholic church didn't want it across the street from them. So so again, it's like, if this were you, wouldn't you want to have a place to go? Where's the humanity?
Disabled people are a part of this too. There is less in engagement with the economy, but the amount of care work that people are doing on a daily basis to keep their families going, you know, being there with a relative caretaking, also just like the ideas and that people are talking about, are bringing to like even different spaces, you know, the histories that are given to children and to myself in terms of people that aren't in the economy that are such an essential part of our world. Disabled people and seniors, I just want to say like they're just
100%. You should be, I mean, that should be able to be taken care of, right, and have those resources. So thank you all so much for being with us today. It was a great discussion, and certainly we'll
Thank you very much for listening.
About policy ideas, project ideas, and all that.
Thank you.
Of course. Now we're going to move on to panel number 2, which is going to discuss some of the policy solutions. So Rep. Bottom will go right, the good segue question there. And our first testifier is virtual, so we have Eric Tars, who is the Senior Policy Director at the National Homelessness Law Center, and then we have one in person as well. But go ahead, Eric, the floor is all yours. I know you have a time restriction, so we'll start with you.
I appreciate it. Thank you, all the hosts and your staff for organizing this hearing today. My name is Eric Tars. Again, I serve as the Senior Policy Director at the National Homelessness Law Center. And while our organization is based in D.C., I work from home in Philadelphia. So while I bring national expertise, I have a special interest in seeing Pennsylvania adopt the best, most effective policies on homelessness and avoid adopting the worst in the wake of the disastrous Johnson versus Grants Pass decision from the Supreme Court. Today, I'll give a short summary of the case, provide a national overview of how it's accelerated the pace of communities arresting, ticketing homeless people for sleeping outside, which only makes homelessness worse and disparately impacts Black, brown, and LGBTQ and disabled communities. And then I'll talk about the law center's template legislation to codify the protections that were struck down by the courts. The Johnson versus Grants Pass case, decided on June 28th, started many years earlier in Grants Pass, Oregon, and like many communities in Pennsylvania, Grants Pass has seen a dramatic increase in population, almost doubling in size over the past 20 years, but it has not built enough affordable housing to keep pace with that population growth, and has a less than 1% vacancy rate, skyrocketing rents, and when people can't afford the rent or find new housing, they end up homeless. Rather than meeting that need of affordable housing for its citizens, or even providing basic emergency shelter, Grants Pass chose instead to demonize its homeless residents and pass ordinances that literally made it a crime to so much as wrap a blanket around yourself to protect you from the cold if you don't have any other place to go. Gloria Johnson and several other homeless plaintiffs brought the city to court to demand their right to be freed from this cruel and unusual punishment under the 8th Amendment, and building on the ruling from our 2018 Martin versus Boise case in the Ninth Circuit, they won. And then they went and won again when the city appealed the case to the Ninth Circuit. But then this year, the case finally made its way to the Supreme Court, and the court unfortunately sided with the city, and as Justice Sotomayor says in their dissent, leaves the most vulnerable in our society with an impossible choice: either stay awake or be arrested. The majority did say that no one has to criminalize homelessness, and that homeless persons may still have other constitutional protections, and they noted that cities are free to take other more constructive approaches that will actually help to end homelessness. Unfortunately, despite those caveats, in just 2 months since the decision, more than 3 dozen cities across the country have already taken the court's permission and run with it, passing new, more punitive measures against homeless people, and another 2 dozen measures pending. Here in Pennsylvania, just a few exits down the turnpike from Lancaster, as has been mentioned, Pottstown is currently fighting litigation that has stopped its plans to arrest its homeless residents for needing to sleep outside in the city that has actively prevented homeless shelters from being established. A few exits further is Norristown, which closed its shelter and had a city councilor threaten to bus the community's homeless members to Villanova University as a political stunt to protest the professor there's defense of their encampment. And then a few steps further on is Philadelphia, and where the lack of treatment beds has not stopped sweeps of homeless persons facing eviction in the Kensington neighborhood. None of these criminalizing practices actually help address the public health or the public safety issues that cities claim they are trying to remedy, and in fact, they make them worse, keeping people and tents on the streets for longer. These stories repeat all across the Commonwealth and the country, often with communities engaged in a downward spiraling race to the bottom to try to make their ordinances harsher and reduce services under the theory that this is going to drive homeless people somewhere else, ignoring the research that shows that most homeless people are in the communities where they were once housed. And speaking of races, because homelessness disparately impacts Black and brown communities, as well as LGBTQ individuals, particularly youth, and people with disabilities, criminalizing homelessness has deeply inequitable impacts. In fact, studies show that Black people experiencing homelessness are close to 10 times more likely to be targeted for enforcement of these low-level citation offenses than white people, and more than half the people in some county jails are there because of homelessness. So this is the entry point for so many into our criminal legal system, and each one of those unnecessary police encounters is a potential source of violence. In some communities, more than a third of all use of force incidents were against unhoused persons. If you want to stop the over-incarceration of and police violence against Black and other marginalized people, you couldn't do much better than stopping the criminalization of homelessness. The best way to do that is to make sure that no one is on the streets to be criminalized in the first place by ensuring that everyone enjoys their human right to safe, decent, affordable housing. The public is with us on this, with 3 out of 4 Americans agreeing that we all need a safe place to sleep, and housing, not handcuffs, is the best solution to homelessness. But until that happens, the next best way to stop this race to the bottom balancing case and set the ground floor for stopping enforcement of such laws until there is an adequate alternative place where people can go. This legislation is grounded in surveys of unsheltered people and addresses many of the concerns raised by those directly impacted individuals, such as the need to bring their pets, partners, and possessions with them whenever they are removed from an encampment. There are a few examples of other so-called homeless bills of rights that have passed in other states, and people may be aware of an Oregon law that requires communities to only put in place quote-unquote reasonable restrictions on where homeless people can sleep, but in our view, none of those are strong enough models to actually stop the harms of criminalization, and our template is designed to avoid those mistakes. This bill can't end homelessness on its own, but it can help stop the most harmful practices communities are engaging in, and then redirect their energies into steps that will. Until housing is recognized and protected as the human right that it is, we must at least protect the basic civil rights of the people whose right to housing has already been violated. Communities are already passing these harmful bills, and so we need to act with urgency to stop the race to the bottom. As a Pennsylvanian, I would love to see us here leading the charge to stand up for people's rights and correct the Supreme Court's awful mistake. It is time for our elected officials to do their jobs and ensure everybody has a safe place to call home. I'm happy to answer any questions and give any service to your teams as they can be.
Thank you very much, Eric. We're going to do your Q&A because you have to jump off from a time restriction. So I will start with Representative Smith-Wade-El.
Thank you. Eric, can you hear me?
You're a little quiet, but yeah, I can hear you.
Okay, we've daisy-chained a couple of audio-video systems together, so please bear with. Thank you. Thank you for your testimony. Two questions, real quick. Are you aware of, as something of an expert, are you aware of any instance in which, along someone's journey through houselessness and indeed returning to housing, are you aware of any instance in which they're being separated from possessions, say a backpack, a tent, separated from a pet or a loved one, any instance at all has aided them in their journey in returning to housing? And I know that sounds like a very strange question, but I'm going to ask you to answer it anyway.
Sure. As a national expert, I am unaware of any example where separating somebody from their possessions, their pets, their partners, the things that they need to survive has actually aided them in exiting homelessness.
Thank you. And then sort of a more, just wanted to have it said, sort of a more practical question. What or where could somebody look for best standards for how emergency or low barrier shelter should operate, manage issues like disability, pets, gender issues? Is there a national standard best practice that communities might look to? Because I think many people, many communities have shelters and they struggle with environments and eligibility and how to manage these things. Any direction there, Eric?
Yeah, so I'll say that the National Alliance to End Homelessness, the National Healthcare for the Homeless Council, the Corporation for Supportive Housing are all groups that have best practices on their website. They can provide technical assistance. The U.S. Interagency Council on Homelessness also has best practices and technical assistance available, and they have a regional representative assigned to the Pennsylvania region. So there are lots of resources out there. HUD is also able to provide technical assistance to communities on best practices in care. And I'll also just kind of link back to some of the earlier conversation and say that all of this is taking place in a context of artificial scarcity, and that's so much of the problem is that, as I forget who it was that said about, if you look back to history, from about the 1930s up through the 1970s, we did not have mass homelessness in this country. We did, as Franklin Roosevelt said, we had adopted a sort of second Bill of Rights, including the right of every American to a decent home, and we put in place the policies to actually ensure that. And so people had disabilities, they had addiction, they had low-paying jobs, but there was enough affordable housing for everybody, whether it was affordable rental housing through public housing or later Section 8, or through the even greater subsidies that we gave to predominantly white suburban communities through development incentives and the mortgage interest income tax deduction. But we were providing a huge amount of housing subsidies, and that's actually what laid the basis for kind of the success of the greatest generation and the growth that we saw in the 1950s, 60s, coming out of World War II. It was in 1980 that Ronald Reagan came in, cut the affordable housing budget for HUD in half, and it's never been made up in the past 40 years. So we've been losing affordable housing for the past 40 years. The best solution to all of this is to get that level of support back in place. And kind of the mistake that we've made has been treating homelessness as this emergency that should be dealt with shelters rather than just fixing the housing problem that caused it in the first place. And so we are now in this situation where we do need emergent things like more low barrier shelters or
your name.
like immediate harm reduction methods. But ultimately, if we can't just let our attention be there, we need to focus on those root causes as well.
Thank you, Eric.
Senator Saval had to leave early, and he asked me to ask this question, which I chuckled at because I did not say the representative's name correctly prior to introducing to him. So I said, do you really want me to ask this question? But I'm going to give it a whirl, Eric. I'm humble enough to admit my mistakes. Could you speak to the concept of inclusive public space management, and in particular, how we help people who are in encampments or staying outdoors, but who may require services where they are?
Yeah, so many of these laws criminalizing homelessness are basically about who is entitled to be in public space. And this comes from a long history, reaching back to Jim Crow laws in the South and in the North as well. Kind of regulating sundown towns about when black people could be in certain areas, anti-loitering laws that criminalize anti-vagrancy laws that criminalize formerly enslaved people for simply being in public without employment, and then pass them through the 13th Amendment loophole back into effective slavery. And our current laws that regulate homelessness come from that tradition, and we need to acknowledge that for those racist origins, for the racist impacts that those laws continue to have today, and say if we want to take an affirmative anti-racist tack, we need to stop enforcing those laws and instead look at the needs of people in the places where they are, take a broader view of what public safety means. Public safety, in the context of an encampment, does not mean pushing those people out of the place where they have found temporary stability to some other place where they aren't going to have that stability, even if there are immediate public safety needs, if there is some other crime that is taking place in that encampment, just as if you wouldn't bulldoze a home just because a crime is taking place there. We should not be bulldozing encampments just because crime is taking place there. We need to address and mitigate the harms in place and like to live in, in trash and squalor, if you give them trash bags, if you give them regular trash pickup, they will take care of the places where they are. And if you are able to address individuals within the community who are causing public safety issues, then you can, address those individual issues without needing to punish the entire encampment. And then, nobody's saying these encampments should be there forever. That's not, a win for anybody. But you can actually address those public health, public safety concerns, and then work to get those individuals into housing. And that's how you close the encampment, is by you end encampments by ending the need for encampments. If you end the encampment without addressing those underlying needs, it just means people are going to go elsewhere. Homeless people are really good at improvising in the absence of adequate solutions in our communities. And if you don't like where they're improvising right now, you're probably not going to like where they would improvise next. And so it's always in the community's best interest to make sure there's a better place for people to go, because otherwise people are going to make it up themselves.
Thank you so much, Eric. I want to be respectful of your time. I know we could talk to you all day, and certainly we'll follow up with you to discuss all the policies you put in here and the best practices and what is mediocre versus gold standard. So I think that's a really helpful part of your testimony, and also the mention that the public is with us on this. This is 3 out of 4 Americans agree that we all need a safe place to sleep, and housing is not handcuffs. So I appreciate you putting that in there, because it is more of a political issue. I think the public gets this issue. So thank you so much for being with us. And we have our final testifier for the day. Last but certainly not least, thank you, Dr. Jennifer Frank, for being with us. Set her up the front. Woohoo, she's getting a round of applause. She's the Associate Professor and BASW Coordinator at Millersville University. I have a cousin who went to where you teach, so thank you for joining us today. Great to meet you, and the floor is all yours.
Very good. Thank you so much for the opportunity. I'm happy to be here. My name is Jennifer Frank. I'm a lifelong resident of Lancaster County. I graduated from Millersville. I'm a social worker, and I got my PhD from Bryn Mawr College up your way. My dissertation was about homelessness. It was a historical case study about system building and homelessness services. Currently, I work at Millersville University in the School of Social Work. I've been there since 2010. I've done extensive research on the topic of homelessness. Last March, I was one of 57 social scientists that was invited to sign on the amicus brief that was heavily cited by Associate Justice Sotomayor in the dissent on this decision about Grants Pass. On any given night in the United States, over 650,000 people are homeless by HUD's very restrictive definition. In 2023, that number was 653,104 individuals, which was a 12% increase since 2022. Of these, almost 40% were unsheltered, so that's 256,610 people. The Grants Pass decision is very much targeting this group of unsheltered homeless people. In Lancaster County, last year we had 597 people who were homeless on a given night, which was a 13.5% increase, and that was 122 individuals that were unsheltered, needing to sleep in cars, on the street, and sidewalks. Homelessness is the result of a failed economic and social policy. The emergence, persistence, and growth of homelessness demonstrates the extent to which society is not meeting the needs of all, particularly our lowest income neighbors. The Grants Pass decision allows for the criminalization of homelessness of various kinds, including denying sleep, dispersing encampments, and creating additional barriers to housing. It is cruel and unusual punishment, and it targets unsheltered people specifically. Number one, denying sleep is torture. Sleeping is not so much a behavior as it is a biological necessity. Sleep deprivation is a form of torture. Anti-homelessness laws like this require individuals to be constantly on the move as to not stay in one place for too long or to fall asleep. A homeless man that I spoke to a few weeks ago noted that he basically walks around all night long so that he can avoid getting a citation or being arrested. Chronic lack of sleep deprivation causes serious health ramifications, and prolonged sleep deprivation can exacerbate mental illness, which makes it more difficult to secure housing. Dispersing encampments causes harm. Dispersing encampments does nothing to solve the problem of homelessness. In fact, it worsens the problem, and a lot of the other speakers noted that as well. It sweeps displaced communities, disconnect individuals from their support systems, separate people from their property, and increase their risk of mortality. One recent study found that involuntary displacement can increase deaths among unsheltered people by 15 to 24% over a 10-year period. The only thing displacement and criminalization is successful at ensuring is that housed citizens do not see the destitution of their non-housed neighbors. It creates a facade that all is well, when in reality that cleaned up block might be costing someone their life. I like to think of it too, like if you have people coming over to visit, like you do the quick cleanup and throw everything in the drawers and closets, and I say, don't open the drawers and closets because you don't want to see what's in there, and actually I've made my house more of a mess by doing that. So when we sweep everyone away and disperse the encampments, we're creating more of a problem than we had in the first place, and it causes people harm. Under the grants passed decision, people can be fined and jailed for camping in public. When homelessness is criminalized like this, unsheltered individuals are burdened by fines, arrests, jail time, and criminal records. These are barriers to housing, barriers to social services, and barriers to employment. Unpaid fines negatively affect credit, and in some cases, unpaid fines lead to warrants, which can further disqualify people from public housing, Section 8, or other social service programs. Criminal sanctions do nothing to solve homelessness, they worsen it and prolong it. To solve homelessness, we need to change the societal conditions that generate homelessness in the first place. Unsheltered homelessness is a housing affordability problem, and I really appreciate that I've heard this repeatedly. I mean, ever since the 1980s, there's been this conversation about what causes homelessness and what's the chicken and what's the egg, is it mental illness, is it this, is it that? And I mean, we have 45 years of research that demonstrate very clearly that homelessness is a housing affordability problem. And if I have risk factors such as severe mental health issues or drug issues, I'm just more likely to be at risk for falling out of the bottom of the housing safety net, which there's not much of one. Wages have not come close to keeping pace with housing. Skyrocketing housing costs spurred on by gentrification, private equity firms buying housing, these things have exacerbated a growing problem. Housing needs to be recast as a human right and not a get-rich-quick scheme. People's lives are at stake here. Number one, we need to keep people housed and prevent evictions. We need to eliminate unnecessary evictions and provide targeted rental assistance to prevent homelessness. Some funders years ago used to say that it was not possible to accurately predict who was going to become homeless, but that is not correct. There are plenty of studies and models that can demonstrate what combination of risk factors makes homelessness most likely. Preventing eviction saves families the trauma of homelessness and is more cost-effective in the short and the long term. We need to provide adequate emergency resources. We need to adequately fund and provide low-barrier emergency and temporary shelter. In Lancaster, we just lost the 80 low-barrier beds, leaving people with basically no options for a low-barrier emergency shelter. Because it's expensive and challenging to operate low-barrier shelters, we need state and local officials to allocate adequate funds to organizations who step up to operate such facilities. The community needs to also explore other temporary measures such as safe encampments, safe parking lots, models that have worked elsewhere. People need a place to be, they need a place to be safe, they need to have a place to sleep. We need to make housing possible for everybody. Housing vouchers, like Section 8, make market rate housing affordable to people because they pay 30% of their income towards housing. There's a plethora of evidence that deep, open-ended housing subsidies prevent poor families from becoming homeless. We need to increase efforts to target subsidies to those who need them the most: homeless households and extremely low-income households. I think a lot of times our social services sometimes target people who need help the least because they're the most likely to show that that organization is successful. But what we need to do is target all of this effort to people who are most vulnerable. We need to increase permanent housing options for the poorest renters. We talk a lot about affordable housing, but affordable for whom? It needs to be affordable for the poorest people in our community. In the 1970s, under the guise of urban renewal, many single-room occupancy units were eliminated Sometimes people talk about deinstitutionalization of the state hospital as the precursor for the massive homelessness in the 1980s, but I think it's actually a combination, more complicated than that, because those folks didn't become homeless right away. In the 1970s, we got rid of a lot of units, of very, very affordable, low-income units. A lot of times they were SRO units, and the culmination of all of those things together produced massive homelessness in the 1980s we call modern homelessness. That was a policy decision. SROs provide poor renters with a small personal space and shared amenities. We need to convert empty, unused, and underutilized buildings and hotels into SRO units. We need to increase other opportunities for low-income housing for the poorest households. Expanding housing options for low-income households might require overturning exclusionary zoning policies to allow for higher density housing in some areas. We need to make inclusionary zoning mandatory and provide additional incentives if necessary. We also need to make work pay. We need to increase wages. In Pennsylvania, we still have the $7.25 minimum wage. Pennsylvania needs to increase the minimum wage. Right now, a person would need to work 173 hours per week at $7.25 an hour to afford a one-bedroom apartment in Lancaster County. We need to hold the private sector more accountable as well. Economic gains through increased worker productivity have not led to an increased workers' share of profits. We should make profit sharing mandatory or provide tax credits to organizations who do that. Worker power needs to be strengthened through the support of unions and collective bargaining. Incentives could be given to private sector corporations whose workers are organized, and laws need to be passed to make sure that workers are not intimidated or disenfranchised from organizing. Lastly, we need to strengthen the social safety net. An example of this is the Earned Income Tax Credit, which is effective. There's appeal to both Democrats and Republicans because it incentivizes people to work, it incentivizes people to file their taxes, and it actually eliminates poverty. Because what we're talking about here is criminalizing poverty. Homelessness is the result of being very poor and not being able to afford housing. We should increase state contributions to the EITC and expand that. And we also should increase SNAP benefits and other resources like child care subsidies to free up more income for housing and housing-related costs. We have to expand the social safety net. Criminalizing homelessness gives political officials and the greater population the wrong idea about what homelessness is about. The reality is that homelessness can happen to anyone given the right mix of unfortunate events. In the end, the persistence of unsheltered homelessness is a policy choice, and the ways in which we treat our unhoused neighbors is also a policy choice. The criminalization of homelessness provided for by the grants pass decision worsens the homelessness problem, traumatizes those experiencing homelessness, extends bouts of homelessness, and increases their already high risk of mortality. None of these policy ideas that I'm saying right now are new or revolutionary. We need the political will to make policy decisions that are informed by both empathy and a true understanding of the issues.
Thank you very much. Feverishly taking notes and highlighting your written testimony. Thank you for providing such thorough, organized written testimony. I keep all my binders. Would you like to start with the first question? No?
I would be happy to do that real quick, Dr. Frank. Tell us what a BASW is, because it's on the piece of paper.
A BASW is an undergraduate degree in social work. So I have an undergraduate degree in social work, a master's degree in social work, and a PhD in social work. And I don't know if I noticed this, but I worked for over a decade in homelessness services in Lancaster.
Thank you.
Yeah.
So you said a lot to us, and I think your work in the field is certainly well known to some. We have talked a lot about Philadelphia. We've talked a fair amount about statewide interventions in Lancaster. I often try to tell people this: legislators, very simple people, much less smart than we're given credit for. Next best thing that perhaps, not the three of you, you're very yeah, don't, you know what, I'm not even gonna go down that road. Anyway, next best thing do you think the state legislature could or ought to get its hand, get its hands and brain around? Like if we were going to, which is not to say the exclusion of all others, We're about 8 session days away from the 2024, from the 25-26 session. What should lead our focus in terms of addressing homelessness?
That's a tough question, obviously. It's like, what's the silver bullet that's going to fix this whole thing? And I guess I don't know if there is one. It seems like it's a combination of things. It's wages don't keep pace with housing costs. It's housing costs are escalated, in part because of gentrification and other firms coming in and buying housing and absentee landlords, all of these. It's this culmination. One thing I think that might be unique to the United States is a lack of collaboration between sectors, and this might be an artifact of how we, quote, discovered modern homelessness in the early 1980s, because at that point, as we do, homelessness was being treated like an emergency, and somebody said that earlier, there's a really great article about that. When we treat things like homelessness like an emergency, then we miss out on more sustainable long-term final solutions, like permanent solutions. So in the early 1980s, you have all these small charities, soup kitchen here, and we're seeing the same thing again, I think, of small charities not coordinating necessarily with each other. We like to do what I call like designer charity. I mean, we have the Extra Give here in Lancaster. You can pick any charity that you want that does exactly what you want to do with exactly the little population that you feel passionate about. So we're missing this overarching collaboration between sectors. And I think in the early 1980s, that was by design, because through the McKinney-Vento Act of 1987 under Ronald Reagan, we funded those disparate charities. And what it did was it created a new sector to address homelessness with services. And you can't solve homelessness with services. You solve homelessness with housing. And because we developed this separate sector, now we blame the homelessness services sector for not solving the problem. If you look at other countries, it's not really like that. There's a lot of collaboration between child welfare and the prison system and the hospital, and it's sort of this collective ownership of the responsibility. And I think we need to start there. For a big picture thing, we need to figure out how to stop playing institutional hot potato with the issue of homelessness and figure out how we can have ownership of the problem. That's also going to require us to have collective empathy. And to the extent to which we hide our homeless people from the view of the unhoused, that empathy isn't going to come up because we don't know there's a problem. I mean, look at Binns Park now. It's clean. It's pristine. If I wasn't from Lancaster, I'd be like, oh, they don't have a homelessness problem here. But emboldened by the Grants Pass decision, the folks who were sleeping there have been dispersed out of all the city parks in Lancaster City. They're very difficult to find. Outreach workers don't know where people are. They're, disconnected from what they need. We spent the county commissioners spent $107,000 to put up a 3-foot-high fence, which basically pushed folks just out from under the ledge so that they're in the rain and the elements. So I don't know if I answered your question, but I have a lot of things to say. I think we should develop SRO units as well. If we want a small win, we need more SRO units.
Thank you.
Rep. Bob.
Thank you, Senator Muth. You teed up my question perfectly.
Okay.
So I just have had multiple conversations in the last week that have kind of like got me going. I texted Senator Muth the other day about how infuriating it is. So I had a conversation with a business owner that I have known for many years a few weeks ago, and he said to me, we were just talking about political positions, and he said, you know me, I'm a trickle-down guy. I tried to instill in my children the fact that without tax credits and without charities, the world wouldn't operate, and that in order to, corporations giving to charity is what solves the world's problems, right? That was his perspective, and I just rolled my eyes at him and said, we're going to agree to disagree on that one, and ended that discussion. But then a week later found myself in another setting, and I'm going to try my best not to reveal where it was, but it was around food insecurity. I was surrounded by corporate executives representing their organizations, chambers of commerce, talking about the impact of food insecurity and how that is growing dramatically right now. And what I walked away from that saying was that it is infuriating to me to sit in a room filled with people who are part of, when we're in Harrisburg, the very organizations that are fighting against raising the wage and fighting against funding for the solutions, housing, subsidies for food, subsidies for childcare. But they get their tax credits to show up at that PR event to talk about the impacts of food insecurity and how they're great community partners because they're giving to charity, right? Our boutique giving. And so when you mentioned tax credits for profit sharing, I'm curious to learn more about that. I feel like if we're going to be giving corporations tax credits, they need to be holding up their end of the deal and not actually being the root cause of the problem in the first place, because they're not paying their workers and they're not giving dignity to our workforce.
Yeah, I mean, I agree with all of that. That's really interesting. I don't know that charities solve social problems. In fact, they might make it worse. So if you really look at charities, it's like, who are they designed to serve? The people who want to volunteer and give and feel good about their giving, or the people who are receiving those benefits from that charity? I mean, it's both and, I think, to some extent, but we have a long history in the United States of really catering to the people's need to give more than actually solving the problems that the charities seek to fix. You see that a lot with food. I'm involved in that area as well. And actually, there's a great article from the early 1980s by Matthew Stern, who talked about how the emergence of homelessness as a social problem reinstated the giver and the benefactor in that hierarchical relationship, and it offered another opportunity for well-meaning good people to serve the poor, you know, and that in a way further disenfranchises the poor homeless folks, and it embeds this, again, looking at it as an emergency. In terms of profit sharing, I don't really have much of that spelled out, except for the fact if we look at, when we're talking about raising minimum wage and looking at all of the economic gains we've had as a state and as a country overall, and how little the actual workers who produce that value have access to the wealth that it generated. It went somewhere else. So we could be creative in that. Look at what other countries are doing, see if there's ways to maybe give tax incentives to companies that are offering stock holdings to their workers, or even operating like a collective and that type of thing, like joint ownership of these businesses instead of the workers doing the work and the business owners getting all the business and the money. I don't know about trickle down. I think that business is bad, or homelessness is bad for business. If we look in like where are homeless people located, well, when they're in the business district, the businesses don't really like that. And then when we move people, they go to less and less desirable locations. They go to more dangerous places. How do you think homeless encampments show up under bridges and turnpikes? It's because they've been relocated to the least desirable location of all. So when we do that, if we think about, do we value people or do we value place? We did a community research report here a couple years ago looking at Binns Park again. And one of the big findings that we had was that the closer firsthand experience you had to people who were homeless and who you knew them by name, you were mostly and predominantly concerned about people and the well-being of the individuals. The further back you get, people are more concerned about public space and how, was it clean? Was it safe for non-homeless people to enjoy? So there's this dichotomy between public space and people. And it's like, what do we care about the most? The great irony is, I think we care about both, but if we would take proper care of people, clean public spaces would result. It might take a while, but if people had a place to go and they had permanent housing, we would have both of those benefits.
I'll just end with chiming in on your question. Is I think there's a book called Winners Take All. I don't know if you've read it.
Didn't have that.
And just about this historical and, you know, embedded thought process of the rich giving their money to goodwill and like,
Right.
versus them just paying their fair share in taxes, right? And so, or corporations, could be either, right? And that there is this celebrated thing about being a charitable donor and like your name's on the program and all these things. But to your point, it makes those people feel like they did something good. But what's the impact in reality? Yeah, it might help, but it's not fixing the
That's right.
solution. And so I was volunteering at Mitzvah Circle. It's an organization in Montgomery County, and found to learn that they actually provide over a dozen school districts with their sanitary products, which I'm all for having in every public every bathroom, right? But that the school district's not, they're going to the charitable organization, as well as the county prison, the juvenile detention center, and the county does not fund this nonprofit. So I was there for a day of service on 9/11, and one of the other volunteers was, you get a card to pack a box for someone who is in need, and the situations are, all over the board. And it's like their story, so you read, and then it gives you their size and clothes and things. And she goes, oh my God, this person lives on my street.
Right.
And it was like this moment, and so I think it shows, I think everyone should do a day at Mitzvah Circle to build that empathy if you're not aware, that this isn't just people living under a bridge. There are people, medical illness, loss of paycheck, away from being someone who's unhoused. And the real thing I wanted to ask you about was benefit cliffs. What are your thoughts on those? Because a lot of people get a wage increase, they lose their child care subsidy. We had a veteran get a Social Security disability increase, I think it was like peanuts, kicked him out of their, where are we gonna find them a place to live at $700 a month? So, is there any,
So I could sit here all day.
Follow up with me,
So,
because I know we're short.
I have three things for everything you said. So I remember when I was working with homeless families, I had one client that I worked with who was homeless with her daughter. And we found her an apartment, and this was years ago. And the first thing I noticed when I helped her move into the apartment is that she had almost the same CDs. Now, this was when we had CDs. Same CDs as me. And she was and I said, this could be me. And at the food pantry that I work with, we had a family come through, and it was like the parents of someone that we graduated high school with, and they were like, please don't tell so-and-so that you saw it. So those are the experiences that make you think we're all in this together. If we have unsheltered homeless people in our community, it's on us as well. As Frere said, if one is oppressed, then all are oppressed. My liberation is wrapped up with yours. So I think we need to think about not us and them. Homeless people aren't a certain kind of person. We're all together. You also mentioned about how we pat charities on the back or corporations for giving and we have a history of that, like going back to the Gilded Age. The idea of philanthropy was really Rockefeller and Carnegie trying to hide their wealth in a place where they didn't have to pay taxes. And then we give philanthropists all the leeway to decide what social problems we fix and what we don't fix and how we do it. And so we need a whole revamp of that. Okay, so that needs a revamp. And the other thing, what did you say also? Senator Muth, there was
Benefit cliff.
The benefit cliff is another mess.
Did a thing where they just said, you know what, for 6 months, this was in 2019, because I went to a conference, they're like, we're not going to kick you off any benefit for 6 months, because you're going to build a nest egg, a little bit of savings, and then from there, you're going to meet with someone, almost like not a social worker, but like, a financial guide person to be like, okay, what can we work with here and set those goals? And so that is part of the problem is we have these assistance programs that once you make $1 more, you are off. And
I have a great video I can share, actually.
Okay, if you can send it.
I absolutely will, because we have a residual social welfare system, and that means that public welfare doesn't kick in until everything else is broken down. And it's also disparate that you have food stamps, and you have public assistance, and you have SSI, and you have Social Security, everything, it's not a seamless system. And so when you do make more money and you go over the benefits, you lose more in benefits than you do in your income gain. So it's actually designed to set people up for failure.
I've had child care workers, when they were doing the increase in their wage, say, please, dear God, do not give me the $2 more an hour, because I will lose my $6,000 child care subsidy. And these people have master's degrees,
Right.
Working in these schools with the youngest minds that we need to develop correctly, right? And these are people, working families that, again, one car accident, one big thing happened, house burns down, you are in this
Absolutely.
new bucket of people that is unhoused, and what do?
Well, then we also use those decisions to disparage people who get public benefits. We're like, well, you don't want to work? You know what? If I was in that situation, I would absolutely say, don't give me a $2 raise, because I'm looking at the overall well-being of my family. I think we also
$2 more, pay, an hour versus like you lose a $6,000-7,000.
Right? Who wouldn't?
It's math. Like,
I think
nobody's doing that.
we need to reframe what public assistance is. I mean, one of the biggest things that the government does for homeowners is the mortgage interest deduction. You know, if you own your house, you can deduct the interest on your mortgage. That actually is a huge amount of money that the government doesn't take in. But we don't say you're a welfare recipient if you deduct your mortgage interest on your taxes. You know, so, but we talk about TANF benefits and SNAP benefits in a different way. So I think we need to really address that. In my other notes, like this was the shortened version, believe it or not, but in my other notes, I suggested, universal basic income. We keep doing these pilot projects with universal basic income to see if we gave people a bottom line of money, would it work? Would it work? And we just keep testing it. It works every time. But, we need to do something like that, which would give people a kind of a safety net.
100% agree. It'd be better than handing corporations a bunch of subsidies and tax cuts. We could give it to the people. Thank you so much for being with us today. We enjoyed discussing all these things, all the problems of the world, and looking forward to working with you to solve them. So thank you for participating. Any closing remarks? Representative.
I will note offhandedly that the mortgage interest deduction costs the United States about $70 billion a year, which is more than twice what we spend on all other public housing spending. We spend about $32 billion on Section 8 and associated programs. The mortgage interest deduction is $70 billion in unearned revenue, which is not what I intend to use my closing remarks to talk about, but rather, I think the thing that most occurs to me as we discuss these solutions as colleagues is something that I believe it was Sterling pointed out. Much of this is available to us. We have a 200,000 shortage of affordable homes in the Commonwealth of Pennsylvania. We actually know how much it costs on average to build a new home, and we know how many we need is the thing. And after that, it becomes a math problem, and then after that, it becomes a question of political will. But the thing that really messed me up, about a year ago, someone suggested to me, Chairwoman, or what they told me was the 30-year fixed rate mortgage, right, as American as apple pie, is a New Deal era invention, and it is the way that people with capital purchase rent control. That in no other scenario could you predict the cost of your housing for the three succeeding decades. Anyway, so thank you for mentioning that. I just want to, since Sterling mentioned it, do want to mention have a piece of legislation, the Ready to Rent Act, which would seal non-fault evictions. It is a small thing, but evictions are how most people who are unhoused become homeless, and they're also how people stay unhoused. Indeed, landlords take those and they see where there is an eviction filing on somebody's record. They move that to the bottom of the pile and throw that in the trash. But, and forgive me, I'm going to go way out and then I'm going to come back. The credit reporting agencies used to track eviction records. The Consumer Financial Protection Bureau said, no, you can't do that. And then a bunch of little background check companies popped up, kind of like mushrooms after rain, if you will. And they buy this data in batches from our county and state court systems. But if you've ever been on the unified judicial system, the data that pulls through it's a line across the top. It's like name, date, who's involved, date of adjudication. It won't tell you if it was non-payment or lease violation. It won't tell you if it was $500 or $500,000. It won't tell you if domestic violence was involved, which is supposed to be an affirmative defense in the Commonwealth of Pennsylvania, and this is the one that gets me. It will not tell you if the case was withdrawn, dismissed, or the tenant the judge found in favor of the tenant, which is to say there are people in the Commonwealth being denied housing over evictions that literally did not occur. They didn't happen. Nothing happened. And that always blows me away. But it does, having talked to a lot of neighbors across the Commonwealth about these issues over the past 2 years, it does kind of underpin how important this issue is, and as our testifiers have framed, not to give Ronald Reagan any particular smoke, not that I don't have it for him, but it's not the point of this hearing, is that rather than presuming that benefits sort of rain down like manna from heaven, rather that I think we're learning quite clearly that when we protect the most vulnerable folks in our society, what we end up doing is protecting all of us. So thank you everyone for taking the time. I want to thank Senator Saval and Chairwoman Muth, Reps Freelot and Rep Warren, the staff, the City of Lancaster, and of course the city staff for letting us use the venue. Sort of the genesis of this hearing, Chairwoman Muth was nice enough to help us out. In the wake of the Grant Pass decision, as Senator Saval mentioned, we released a co-sponsorship memo on exactly these issues, and wanted to have this information from our testifiers to inform the legislation that we would ultimately introduce. And I am going to end where I started by saying this is not the only place that I'll be taking in information to inform that legislation. I will also be taking it in at the community conversation on homelessness on September 25th at 57 Laurel Street from 7 p.m. to 8:30. I hope to see you all there. That's my story. I'm sticking to it. Thank you.
And invite somebody else that wasn't here today. Spread the word, right? Get more hands on deck. Thank you to everyone who joined us. We had a great public participation day. I don't know how the live stream could see, but we had a great crew out in the audience. And thank you to my colleagues, Rep. Smith-Wade-El, and then Senator Saval, Representative Perry, Representative Otten, for participating today. And as we mentioned, all 67 counties have to solve this problem. And our testifiers did a phenomenal job, and appreciate their input, their expertise, and just sharing their stories and the things that they've learned in this work. And I look forward to, not even look forward, I just want to get this done, right? This is just a dignity issue, and every party affiliate knows there should be no partisanship here, but unfortunately, we live in a world that's different, and we will persevere through that. So for anyone who also joined us today that you want to submit any comments or share your thoughts or experiences, you can do so at senatormuth.com/policy. There's a little button there. And like I mentioned, all of the written testimony has been uploaded to our website, as well as a recording of this hearing will be available probably by tomorrow. So thank you again for joining us today, and thank you to the City of Lancaster for hosting us, and everyone have a great weekend.
Thank you all.